A Harvard researcher claims 6 common foods in your kitchen could be fueling cancer growth, but what does the science actually tell us? Dr. Thomas Seyfried from Boston College has spent decades studying cancer, and his theory challenges conventional thinking. Rather than viewing cancer purely as genetic bad luck, he argues it's primarily metabolic, essentially about how our cells create energy. Think of healthy cells like efficient power stations using oxygen to generate energy. Cancer cells, however, switch to a primitive, inefficient process called fermentation, similar to how yeast produces alcohol. And crucially, this harmful fermentation thrives on the foods many of us eat daily. So what are these 6 culprits? Ultra-processed meats like bacon and ham, classified by the WHO as Group 1 carcinogens, sugary drinks that spike blood sugar and drive inflammation, deep-fried foods, especially when cooked in reused oils, creating toxic compounds called acrylamides. Then there's charred meat from high-temperature grilling, producing DNA-damaging chemicals. Alcohol, even moderate consumption increases cancer risk. And finally, ultra-processed foods like ready meals and packaged snacks loaded with preservatives and unhealthy fats. The alternatives: swap processed meats for home-cooked chicken or plant proteins like lentils, replace sugary drinks with coconut water or herbal teas, choose baked or air-fried options over deep-fried, use gentle cooking methods and antioxidant-rich herbs when grilling. Beyond just food swaps, Dr. Seyfried and others highlight metabolic therapy, a set of lifestyle interventions that may help prevent or manage cancer. This includes ketogenic diets, calorie restriction, regular exercise, stress management, and sometimes medications that target how cells use glucose or glutamine. Importantly, these are considered complementary approaches, not replacements for standard medical care. Mainstream cancer prevention guidelines also emphasize lifestyle. Aim for at least 30 minutes of exercise daily, prioritize sleep, manage stress, and stay hydrated. These habits support your body's natural defenses and overall well-being. Now, here's the balanced perspective. Whilst Dr. Seyfried's metabolic approach is gaining research interest, while Dr. Seyfried critiques conventional treatments like chemotherapy and radiation, mainstream oncology points to significant improvements in cancer survival rates over the past decades. Most experts agree that diet and lifestyle changes can help, but these should always complement, not replace, proven medical therapies. Mainstream oncology remains cautious about his broader claims. The evidence strongly supports avoiding processed foods for prevention, but dietary changes should complement, not replace, proven medical treatments. The takeaway: prioritize whole foods, exercise regularly, and always consult healthcare professionals for medical decisions. Be cautious about health misinformation online. Always look for evidence-based sources and consult your doctor before making major health changes.